alaikum. My name's Nyrah. I'm a GP pharmacist and I'm your host for today's health show on British Muslim TV. Now, in today's topic of discussion, we will be discussing oral care and how to look after your teeth correctly. As you may or may not already know, we only have two sets of teeth in our lifetime, including the baby teeth and the human teeth. So it's really important that we do look after our teeth right up into adulthood. To talk about oral care a bit more in detail, I have a brilliant guest. She is a dentist. Her name's Dr. Sehgal. It would be lovely to introduce her and ask a bit more questions about looking after your teeth in the correct and safe way. Hi, Dr. Sehgal. How are you?
Hi, very well, thank you. Thank you so much for having me today.
Oh, thank you so much for coming on. I think a great question to start off with is, please introduce, your role, what you currently do, where you're working.
Amazing. So my name's Surina. I'm also known on Instagram as well as the Foodie Dentist. And I practice in central London in a practice in Baker Street. I'm actually based 2 minutes from Selfridges and I do general and cosmetic dentistry.
Lovely. And what actually led you to a career in industry? And it's a very generic question. What kind of attracted you to the whole dentistry industry?
It's a funny story. I mean, when I was doing my A-levels, the typical Asian parent was doctor, dentist, lawyer. It was very much like that when I was studying A-levels. Yeah. I was always really good at sciences and I kind of hated some subjects like English and art. I was never kind of good at that. So I followed the science route and then I shadowed loads of different health professionals. And I really, really liked the dentistry aspect of things. You get to do something practical, you interact with patients and you have a real positive impact on their overall and general health. So I decided to go down that path of dentistry. And to be honest, at university, I really struggled. It's a 5-year degree. It's very difficult. There's a lot of material to cover. But, then towards the end of my studying, then I started to really love dentistry. I think that's when I really found my feet, when I started to see patients and when I started to do treatment. So that's kind of how I fell into dentistry. It wasn't a story of I wanted to be a dentist ever since I was a child, but it was a very happy ending.
Oh, lovely. I know you probably worked so hard, it's a very long degree as well, but very, very rewarding career to go into as well. And for any aspiring dental students out there, any tips, any advice you would give?
So dentistry is a difficult career. Study hard, work efficiently, because there's a lot of material to cover in dental school. Enjoy the interaction and enjoy the clinical experience with your patients, because at the end of the day, that's what counts so much. We can get really bogged down into learning every single little detail on a lecture, but at the end of the day, it's how you manage patients, how you look after them, and building those social skills. So I think that's really, really important. And it's not all about studying, is that spend time with your patients when you have that clinical time to actually talk with them and grow as a dentist from there.
Brilliant tips. Definitely tips to take on board and for any student out there with any medical degree. And just in terms of oral care now, why is it important that patients actually take the time to look after their teeth, also their gums as well?
Yeah, amazing question. So teeth aren't there to look nice. They're also there to chew. Your speech depends on your teeth positioning. So if you don't look after your teeth, you might need them taking out. That will affect your jaw shape and the aesthetics of things, but also it will become difficult for you to eat and difficult for you to speak as well. So teeth are really, really important. And, the mouth is really the gateway into the whole body. So it's really important because there's lots of research that have shown that if you have, a severe stage of gum disease, then you're much more likely to have things like diabetes and heart disease. So how your mouth health really is linked to so many different systemic conditions.
Very important, yeah. And I think usually some people might, kind of disregard their teeth or their oral health compared to the rest of their body organs. And how often should patients actually see or visit their dentist for like an oral checkup? Is it every year?
So every 6 months, routinely. But if a patient has amazing oral hygiene and they've got no issues, and sometimes the dentist can recommend yearly checkups, but on the whole, for most people, it's 6 months.
Every 6 months. Okay, so it's way more often than some people might think. I think a lot of patients have the idea, it's just an annual thing and that's it. So definitely every 6 months. But important point to make. And I remember during my last dental checkup, I just remember opening my mouth, sitting in the back of the chair, and the dentist calling out a lot of random names and numbers. What are those numbers, and what do they actually mean during an oral checkup?
Yeah, when dentists call out all sorts of funny names and funny things, half people don't understand what they are. Essentially, the numbers that they call out just relates to what tooth it is. So we, as dentists, almost have like a secret code language as to what tooth is what. So we essentially record everything on a dental chart. So, for example, let's say the number 16 relates to a first molar tooth. So it just essentially makes it a little bit easy for us. But essentially, it means each number has essentially a meaning as to what tooth it is in the mouth.
Okay, great. So it's just a way for you guys to kind of categorize the different teeth that you have. I know also during an oral checkup, you also check for, plaque and cavities. A lot of patients, they hear the term plaque, or they think it's just, yellow stuff behind the back of the teeth. What is plaque?
Great question. So plaque essentially is a sticky film of bacteria. So you can feel plaque because you feel that like fuzzy texture on your teeth. And essentially, if you're not removing that on a regular basis, what it can do is it can harden, and that forms something called tartar. So plaque, if you don't remove it regularly, forms tartar, and that's very difficult to remove. And that's something that a dentist or a hygienist will need to remove. Now, if tartar isn't removed, it can actually lead to gum disease. So it's really, really important that you see a hygienist and a dentist regularly so they can remove these bits of calculus that kind of build up. But plaque, essentially, if it's not removed regularly, it can cause not just gum disease, it can cause cavity, bad breath, loads of other problems.
Sure. So there are a lot of long-term complications, patients need to seriously consider. When taking the extra care of removing the plaque and preventing it coming back in the future. And in terms of cavities, is that also something to be worried about? Can easily be reversed and treated?
Yeah, so a small cavity in your enamel can actually be reversed with really, really, really good oral hygiene. So flossing, using a fluoride toothpaste, and also reducing sugar in a diet. But sometimes cavities get bigger and they extend into the layers of your tooth, in which case you'll need a filling. But cavities can be prevented as long as you're firstly seeing a dentist every 6 months, taking on board the advice they give you, using the correct oral care product, so a fluoride toothpaste, brushing twice a day, using floss. But if you don't, then these small problems can become bigger. So that's why it's really important to see a dentist so regularly.
Sure. And you mentioned flossing. Would you recommend flossing for anyone? I think I was reading a quick dentist report in a magazine, actually, and it said from the age of 12, all young adults should actually use interdental brushes and flossing every day, part of their normal dental routine. What are the benefits of flossing your teeth regularly?
Yeah, so that's a great question. The thing with brushing your teeth is that a toothbrush won't physically be able to get in between the gaps of your teeth. Not the gaps of your teeth, in between your teeth. So your teeth in between, they're very tightly bound together. And that's why you need to be using something in between, because a toothbrush won't get there. Now, in terms of your question, as opposed to what to use, floss or TP brushes, sometimes if teeth are naturally a bit more spaced, then floss will essentially just glide through and won't be much use, in which case you'll need to use those little brushes in between. But floss are for those who have slightly tighter bounded teeth. So it's essentially a brush won't fit into those gaps. So you'll need to see your dentist and hygienist to figure out which is better for you according to the space and the gaps of your teeth.
And are there any particular techniques to floss or any things to avoid? Should you let the gums bleed, or is that kind of like a red flag you need to look out for when flossing?
Yeah, great question. So a lot of people say that, oh my gums are bleeding, I should stop flossing. And that's absolutely not the case. Essentially, why your gums bleed is because there's inflammation, because plaque has been sitting there for a period of time. So actually, you need to floss more and you need to clean more in that area. But in terms of flossing, it's quite simple how to do it. It just needs to be shown by a dentist. So essentially, you can use floss picks, which are really, really easy to use. You literally just ping them in and out. Or TP brushes, you literally just insert them in a gentle motion in between each area of your teeth.
Great. So I think that's a really good insight into flossing, the benefits. It's been a really good, useful introduction in the beginning. And I think I actually just wanted to end part one with a statistic. So I was reading the other day, 27% of British people don't actually brush their teeth twice a day. Now, that's quite a shocking statistic. Why is it important that you do brush your teeth twice a day?
Yeah. So plaque builds up all the time, every single second, every single minute of the day. And especially at nighttime, when you've got a warm environment, when you're sleeping, there's a host of bacteria, millions of bacteria that build up in our mouths. And this plaque layer is being formed constantly. If we're not removing this twice a day, that plaque is going to sit on our teeth and is going to be much more likely to cause things like cavities and gum disease. So it's really, really, really important that you're brushing minimum twice a day, morning and evening, to remove that plaque, all that bacteria that's sitting in your mouth, and to prevent you from having dental problems in the future.
Definitely. And I think plaque, foods can cause build up of plaque, like you said before, not brushing. Is there any other risk factors you need to consider when causing, plaque? Can smoking affect plaque build-up?
Load of different reasons why plaque can build up more. So things like you can be medically compromised. So you could have a medical condition that essentially increases or decreases salivary flow, which affects the pH in your mouth, which again affects plaque control.
Sure.
You can also smoking also.
Lovely. Thank you so much, Surina. I think we are going to have a break now. So join us again for part 2, and we'll talk more about dentistry and oral care. Thank you. Welcome back after the break. My name's Nyrah. I'm a GP pharmacist and I'm your host for today's health show. So today we're actually talking about oral care, where I was actually interviewing a lovely guest. Her name's Dr. Sehgal. She is a dentist during part 1, and during part 2 we're going to be asking her a bit more questions about how to brush your teeth correctly, and I will also be touching on the cosmetic industry and how dental implants can also help a lot of patients out there. Hi, Dr. Surina. It's lovely to have you back on.
Lovely to be back.
Let's continue on to part 2. So, a very controversial question to start off with. Should you brush your teeth before or after breakfast? So I've had so many patients say, nope, you have to brush your teeth after food. And then a lot of dentists telling me, no, you have to brush before food. What is the real and correct answer?
So I personally prefer brushing your teeth before breakfast, as soon as you wake up. The reason being is because every single time after you eat or drink anything, you should always wait about half an hour after you eat or drink to brush your teeth. So if we look at most people's daily routine, they probably wake up, eat breakfast, then head out straight to work. It's very unlikely they would leave that half an hour window to wait at home after they've had something to eat to brush their teeth. So I'd always recommend doing it in the morning, just because then it's out the way and you can carry on your day. It's just much easier for your whole daily routine. That's what I personally recommend and what I recommend to all my patients. There are some research and papers to show that brushing your teeth after breakfast is fine, but then again, you must wait half an hour afterwards to do so.
Brilliant. So I think we have our answer there from an expert dentist herself. Brush your teeth before food, generally in the morning time. And how long should the recommended adult actually brush their teeth for. So you'd be surprised how many people actually don't brush their teeth for long enough in order to remove that plaque. How long is the recommended time?
So ideally you need to be brushing your teeth for 2 minutes, and that's the minimum. So and you need to be timing yourself, because a lot of people think they're brushing for 2 minutes when they're actually brushing for about 30 seconds. It's quite a long time when you actually time yourself to clean your teeth for 2 minutes. So it's really important that you time yourself, but minimum 2 minutes, I would say, in the morning and in the evening.
Definitely. I think there's a lot of toothbrushes out there for kids which actually have music on for 2 minutes to allow kids to, brush their teeth and train them for how long you should brush your teeth for. So definitely something to look out for when shopping for any toothbrushes for kids. In terms of technique, a lot of different techniques being discussed. I think there's only one technique that I know you should be brushing your teeth with, and that's not zigzag, but it's actually in circular motion. Is there any kind of technique that you would advise or kind of tips to brush your teeth correctly?
So essentially, the technique that you use when using a manual toothbrush and an electric toothbrush are actually really different. So with a manual, you need to use those, like you said, circular motions between your tooth and the gum line and move it around, and using the correct amount of pressure, which is actually only a minimal amount. Whereas with an electric toothbrush, they're actually designed, they do all the work for you. So all you need to do is just hold it between your tooth and the gum for about 5 seconds, and then move it on to the next surface of your tooth. So the techniques between the two are slightly different.
And would you recommend an electric toothbrush over a manual one? There's so many electric toothbrushes now, and a lot of patients are making that switch. Would you recommend everyone to switch to an electric toothbrush?
Electric toothbrush is just much easier to use. They usually have an inbuilt pressure sensor, which is really important to prevent you scrubbing too hard, which can actually cause your gums to recede. So it has a pressure sensor, so it beeps up red every time you press too hard, which is really, really good. They usually contain a timer as well to ensure that you brush for 2 minutes. And they do all the work for you, because, I mean, if you look at when you brush your teeth, you brush it first thing in the morning and last thing at night, you're bound to be tired. So it just eliminates that stress of the technique and am I doing it right, and I have to do the motions. It just does everything, you just hold it. So it's just much easier to use.
Definitely. I agree on that point. And coming towards more of the toothpaste, are there certain toothpaste adults should be looking out for? I know a lot of patients will just get any old cheap toothpaste, from pound store. Why should you be careful when selecting what toothpaste to use? Some toothpaste are, cosmetically, toothpaste can kind of claim, five shades brighter it can turn your teeth into, or, what sort of things you really should be looking out for when choosing a toothpaste?
So the first thing is the toothpaste must contain fluoride. Fluoride is a really important ingredient which helps to strengthen your enamel and help protect against things like cavities. That's number one. It must contain fluoride. Number two is that some of these whitening toothpaste and things like that, they're okay to use once in a while, because how they work is they just remove surface stain from your teeth. So essentially they have very small abrasive particles in the toothpaste, which actually lift off surface staining, which is really great because it gives you a nice white, bright smile instantly. But if you use it excessively as your regular toothpaste, then it can actually start to wear away your enamel because of that abrasive particle long term if you use it excessively. So these whitening toothpastes are fine to use once in a while, but not every single day.
Not every single day. Okay, great point. Because a lot of people out there might be using it every day, not actually knowing the harm, more harm than good that it actually does to your teeth. And in terms of sensitive teeth, loads of patients out there have sensitive teeth. They can't have cold drinks, some of them, it might be really bad. Any tips for people out there with sensitive teeth that affect, day-to-day eating?
Yeah, that's a really great question. If you have sensitive teeth, please go and see your dentist, because we need to figure out why your teeth are sensitive in order to help you. For example, you could be eroding the tooth away if you have lots of fizzy drinks or something like that, which is causing your enamel to thin. causing sensitivity. It could be that you're scrubbing your teeth too hard and causing your gums to recede, which is exposing your root, which is causing them to be sensitive. It could be a really deep filling, which is causing sensitivity. It could be so many different things. So using a sensitive toothpaste, although it will help your symptoms, won't get rid of the root cause of why it's sensitive in the first place. So it's really important that if you have sensitive teeth, go and see your dentist, figure out why, and then they can help you from there.
Brilliant advice. And another question I actually wanted to ask you was actually about mouthwashes. Now, I was actually reading the back of a mouthwash I was using this morning, and it said not to use it straight away after brushing your teeth. A lot of people actually don't know about that fact. Why is it important you don't mouthwash straight after you brush your teeth?
Brilliant question. The reason being is because toothpaste contains an ingredient called fluoride. So when you use that, it's really important that you leave that fluoride on your teeth for about 20 minutes and don't rinse it off. So if you're using mouthwash or you're rinsing your mouth out with water straight after, essentially you're rinsing the fluoride away a lot more quicker than normal. So you want to wait about half an hour after you brush your teeth, and then you can use mouthwash or rinse your mouth out with whatever you like.
Brilliant. And I know a lot of patients, you know, they will brush their teeth, but they forget to actually wipe down their tongue. There's actually tongue cleaners you can get from Amazon, you can get from eBay, but not many people actually use them. Would you advise someone to actually use a tongue cleaner, or why is it even important to also clean your tongue?
100%. So plaque not only builds up on your what we call hard tissues, which are things like your teeth, but they also build up on your soft tissues, so things like your tongue. So it's really important that you remove that plaque, because if you don't, then it can house things like bacteria and yeast to grow over time. So it's really important that you use a tongue cleaner or a separate manual toothbrush to clean your tongue regularly.
Definitely. So both gums need to keep that clean, teeth, and your tongue as well. And as we're coming towards the end of the show, I did want to actually touch on the cosmetic side of dentistry. You know, cosmetic industry has boomed over the past recent years. You know, with dentistry, a lot of patients actually focus on the aesthetic appearance of their teeth. You know, what kind of different procedures are out there to really help improve the appearance of someone's teeth now?
There's loads of things out there. There's loads of treatments that we can do, and it needs to be specifically tailored to the patient's needs, specifically tailored for what is functional, because some things, I mean, some patients come in and they want this beautiful smile, and unfortunately it's not possible with the way that their jaw is structured and everything like that. So it's really important that you work with your dentist to find out what's possible and what's not possible. But in terms of the treatment options that are out there, there's so many, from things like clear braces, like Invisalign, just to help straighten your teeth, whitening, which is really great, things like composite bonding, which is essentially adding white filling material to the edges of the teeth to improve the shape and the color of them. Also things like veneers and crowns to help improve the aesthetic appearance of them. So there's so many different dental procedures that we can do to improve the cosmetic appearance. It's just finding out what is best for you.
And you mentioned dental implants. Are they appropriate for anyone? You know, can anyone get like an adverse reaction to a dental implant, or is that quite rare?
So it depends on like many different factors. Essentially, the implant specialist will need to assess that. But essentially, if you, for example, are a really heavy smoker, or you haven't got much bone in there to begin with, then those sorts of things can affect the way that the implant is placed or affect the success rate of an implant. Sure. That's something that, again, is quite individual. But yes, implants are great. They're fantastic, and they look amazing.
Definitely. I think, like you said, you know, there's so many different procedures out there. You just need to speak to your dentist first, find out which one might be most appropriate for you, and then take it from there. I think it's been such a good show, such good questions being answered. Thank you so much, Dr. Surina, for coming on. It's been a really useful discussion. You can follow Dr. Surina Sehgal on Instagram, and definitely get in touch with her if you have any questions or queries. Thank you so much for watching for today's show. We've covered a lot of different topics, from how to brush your teeth correctly to using mouthwash and potentially going into the cosmetics industry. Now, if you'd like to rewatch the show, you can watch a recap on our Facebook page, but you can also join us again next week. We'll be talking about a different topic of discussion, one which I'm super passionate about, which is fitness and weight loss. Please join us again next Thursday at 7 p.m. I'm your host. Good night. Thank you so much.